I have worked at Bloomington Primary Care for 2.5 years. I've been a nurse practitioner, however, for over 16 years. I've always been intrigued with science and loved that even from a young age. What really drew me to the nursing aspect of providing care is that intimate relationship you feel like you get with not just the patient but the family as well, and getting to know the whole person and looking at the big picture among what happens between different members of the family. Well, I often ask where they're from, if they were from this area originally. Sometimes I'll ask how they met their spouse, if they're married. I'm very interested to see what brought them to the Bloomington Normal community in the first place. We recently received recognition from NCQA as a Level 3 patient-centered medical home, and we're quite proud of this. It's a big deal because it's important that patients feel like they're at the center of care, and we build the medical home around them. We find that there's increased patient satisfaction. We find that they enjoy being engaged in their care. We encourage people to use the patient portal in order to communicate with us, and we actually like being able to communicate back with the patients in a very timely manner as well. It was quite a lengthy process in order to receive this recognition. We had to demonstrate how we were coordinating care better for our patients between specialists, how we were offering extended services such as mental health, dietary, physical therapy. So we actually are improving access to a lot of services, including medical care that we provide. We increased the office hours here too. We are open extended hours and even open on Saturday mornings, which we have found patients really enjoy. I think probably one of the most impactful changes is the access to care. We can get our patients in almost always same day when they're ill. When they need a regular follow-up, we don't push them off for several weeks, and we find that many patients have had that experience in the past, and they're very satisfied that they're able to receive that care timely. We have found that use of technology is better, not just with the patient portal, but with the type of EMR we have. We're able to have patient registries for various chronic diseases, so we can actually improve our chronic disease management. We can pull up patients who may have diabetes and find out who may be due for what types of labs or services, and proactively reach out to those patients in order to improve their care and outcomes. The proactive part of it, I think, is really what's going to be important moving forward. But we've actually found that as providers, as physicians, nurse practitioners, and our staff members, that we feel more satisfied in the care that we're giving with our patients and in our practice by employing all these other things. So not only are our patients more satisfied, but we feel like we really are getting a lot back from that as well. I think that families then can tell that what we truly care about is the person. We're not in it just for recognition. We really love our jobs, we love the patients, we love caring for people, and we love seeing patients' health improved with the care that we provide. I think that in general this practice is very forward-thinking, and we want to make sure that we're staying up on the different needs of the complex healthcare environment. It's changing all of the time, and we don't want to be stagnant. We want to make sure that we're continuing to engage in all of these new things that our patients are experiencing. In the spirit of what this practice is all about, it's about the continued learning and growing. I'm actually quite proud that I recently finished getting my doctoral degree. It's called a Doctor of Nursing Practice. It's the highest level of doctoral degree that is available to nurse practitioners, as well as other advanced practice nurses. In this program, we really focus on improving patient outcomes, improving patient safety. We want to make sure that we're also learning how to become health leaders, not just for those in the nursing field, but for the healthcare field in general, and also how to be more advocating for our patients. I do enjoy reading. I love reading books. My favorite genre is historical fiction. I enjoy running. I tend to like running by myself. I like the solitude that it brings me and some time for self-reflection. Interestingly, I have a twin sister, and she also works as a nurse practitioner. I guess it was fate that this was the healthcare role that I was deemed to play in the future, and we enjoy being able to share our experience and our knowledge with each other. At the end of the day, I really enjoy knowing that I've made a difference in patients' lives. I like knowing that I'm there to support them during the difficult times that they're going through some of the most wonderful times they're going through as well. And overall, being able to provide that experience of taking care of them for several years, as well as many members of their extended family, it's very rewarding. Family medicine is one of the best places to work.